Miss Purple, the right mind for any time. I created this podcast to raise the awareness of mental illness. If you have any of these symptoms, notify your physician or call 911. Another suicide hotline is nationwide is 988. Thank you. Hi, this is Miss Purple again for the right mind for any time. Now I want to talk about there are 4 different type of restraint that's used in the hospital or in a mental illness setting. The first restraint is non-violent, non-self or harm. It's a restraint that you may have an IV going on, or you may have a Foley catheter or an NG tube, and you may want to pull these tubes out. So you may have to go into soft restraints or hard restraint to keep you from pulling out your medical device. The second type of restraint is for violent towards others and violent to yourself. This is a 4-point leather restraint. Sometimes you have to have on a body vest in this type of restraint to keep you from harming to yourself or harm to other people. It may be for people with aggressive behavior or people with non-aggressive behavior but danger to themselves. The third type of restraint is chemical restraint. And this restraint usually the person is given an IM medication to control his or her behavior. The routine medication for this type of restraint, chemical restraint, is Ativan, Haldol, and Cogentin. Ativan to control the anxiety, Haldol maybe the delusion, and Cogentin to keep you from having EPS. They have twitching and turning from the medication itself. And the last type of restraint is putting a person in seclusion. Sometimes when you give a person an IM, a chemical restraint, you may have to take them out of the environment which have a lot of stimulation and put them in a less stimulated environment. So you tend to put them in a seclusion area. These are my 4 topics on restraint. Thank you for listening to my podcast, Miss Purple, the right mind for any time.